Unless the lessons are learned and fundamental change is implemented, the human and financial cost and sacrifice of the COVID-19 pandemic will have been in vain. The harrowing accounts of loss and grief given by the bereaved witnesses and others who suffered during the pandemic serve to remind us why there must be radical reform.
Quiet Riot.
Hello and welcome back to Quiet Riot. I'm Andreou. The system of building preparedness for the pandemic, that is, our ability to deal with a pandemic, suffered from several significant flaws. If we had been better prepared, we could have avoided some of the massive financial, economic, and human cost of the COVID-19 pandemic. Those are the stark, plain words of Baroness Hallett, chair of the COVID inquiry, in the summary of her Module 1 report. Between the election, the flush of a new government, and the craziness coming from across the Atlantic, this has not received the coverage it deserves. And since I understand that not everyone has the time to read and digest 240 pages of findings and supporting material, I wanted to pull out a few important threads. And to help me do that, I have with me Christina Pagel, Professor of Operational Research at UCL and a member of Independent SAGE. Welcome, Christina.
Thank you for having me.
And also Tom Brufatto, Policy Executive Director at Best for Britain, who led their work running the all-party parliamentary group on coronavirus. Welcome, Tom.
Thank you for having me.
Right, so let's start with some really basic stuff. What was the remit of this Module 1?
So essentially, the remit of Module 1 was to look at how prepared the UK was for a pandemic. So essentially everything leading up to the beginning of the pandemic in January 2020. I think this was very much about what are the structures, what exercises did we do, what was our plan, who made that plan, why did they make that plan, and so on.
So what position we were before this thing hit?
Yeah.
And how do you think it performed against that particular remit?
I think it was a really good report. It was really thorough. It was written extremely well, very accessible, quite authoritative, quite blunt in places.
Mm-hmm.
And I don't know whether it was because it was the remit or because it was the first module, but it was much less about personalities. It wasn't nearly as gossipy in some ways as the actual hearings of Module 2 were, that created a lot of headlines. And it was much more about the failures of structure and the failures in process, which I think is actually what you need in an inquiry. And that's how you learn and do something better next time.
What about you, Tom? What was your overall impression?
I was quite impressed. I was impressed even from the set-go. If you look at the original terms of reference that were set out, I was quite surprised at the breadth and depth of what Baroness Hallett proposed. And I was equally as surprised that the government of the time, Boris Johnson, actually accepted them. So when it comes to the first module, my understanding is they looked at, everything, as Christina said, the preparedness leading up to the pandemic starting, everything through from austerity to forecasting ability, our ability to model scenarios, and indeed the implementation of simulation exercises such as exercise Cygnus, through to, in fact, Brexit. I think that they have done a very fair and balanced assessment of the situation, quite an honest assessment, especially because it does find very significant failings in our preparedness throughout.
So, distinguish for me the top lines. So, if you were to headline this thing with sort of 5 bullet points, what would they be?
5 bullet points?
However many you want.
Okay, so she pulls out quite a lot of flaws. So I think the first big headline to me is that we weren't prepared at all. There was far too narrow scope in looking only at flu. So people say, we looked at the wrong disease. It's not just that we looked at the wrong disease. We should have been looking at many diseases and not just one, right? If we'd only looked at coronavirus, that would also have been a failure. There was never any attempt to actually prevent a pandemic or control it or reduce the number of deaths. That was not part of the strategy. And she calls that a fatal strategic flaw that should have been obvious to everybody. Part of that is what she calls groupthink, but basically far too much emphasis on consensus, not enough challenge, no one really questioning that there wasn't any prevention, no one questioning the underlying assumptions and goals of the planning, and a really narrow remit for expert independent advisors, and everything was too siloed. So that was another really big one. And that went along with that and meant that when we came to abandoning the strategies that we had, there was absolutely no planning on how you would do contact tracing, how you would do isolation, how you would do border control,
Yeah.
how you would close schools. All of that we kind of made up on the go, and that meant we didn't do it as well as we could have done it. And there's one more actually, which I think is really important, is we didn't really have any plans for taking into account how to best support more deprived populations and how to address the fact that we live in an unequal society.
Yeah, I read a book on climate change recently that had this fantastic expression in it that often we're all facing the same storm, but we're not all in the same boat. And I think it really applies here. There was a complete lack of understanding of the fact that a pandemic does not hit everyone equally. There is a sentence in the executive summary that I think sums it up very neatly for me. It says the UK government's sole pandemic strategy from 2011 was outdated and lacked adaptability. It was virtually abandoned on its first encounter with a pandemic. So basically, we might as well not have had a plan at all.
And that's because, as Christina mentioned, they planned and prepared for the wrong pandemic through exercise sickness, and then didn't even implement the full recommendations from that exercise itself. So from the get-go, our leadership had effectively left the UK extremely exposed to such a pandemic, which is why I also think that the whole Module 1 report speaks throughout it of a serious lack of leadership throughout the pandemic response, something that I think everyone in the United Kingdom will probably have felt.
Everyone seems to have latched on to this idea that we prepared for the wrong pandemic, but it's more than that, isn't it, Christina? Because the way we were preparing, even for that one pandemic, did not involve any consideration of how we might stop it, how we might reduce infection, how we might vaccinate a population, how we might improve our therapeutics. It was quite literally just dealing with a number of sick and dead people at the other end.
Yeah, and Baroness Hallett makes that really clear. I think at one point she says, our plan was how do we cope with the number of deaths? And they planned into the 2011 strategy for over 800,000 people to die in about 5 months. And no one ever said, that seems like a lot. Are we really thinking that's acceptable? And one of the other reasons that the strategy fell down as soon as reality hit was in March 2020, when we could see what was happening in other countries. It became very clear that actually we weren't prepared to do that. And sure enough, when the imperial model suggested there might be 500,000 deaths, they locked down straight away. So the whole strategy was based on this assumption that would be okay. And there was nothing we could do about it. Whereas in fact, there was a lot we could do about it. Who decided that was okay? And why at no point did anyone question it? And like Hannah says, it was a blindingly obvious flaw that just went through for over a decade.
I'm really looking forward to Module 2's finding, for the simple reason that if we cast our minds back to the beginning of the pandemic, you could really sense the scientific community struggling to actually try and get the political leadership of the country to understand the severity of the situation in the first place.
Yeah.
There certainly was a period of time in which we were, even as a country, quite fortunate of not being the sort of front end of the spread of the virus. We had some extra time compared to other countries. And the narrative in all of these other countries that were at the front line of COVID was, okay, we need to take urgent measures in order to keep the population safe and adapt to the spread of this virus. At the same time, us in the UK had a prime minister who was sort of making a song and dance about visiting hospitals and refusing to wash his hands and all of the rest of it. And you could just feel and sense everywhere you look, the scientific community sort of
tearing his hair out.
Yes, and that's one of the reasons why I'm so pleased to see the terms of reference on the inquiry include a specific point of paying due consideration to international comparisons. But actually, there's a very important story.
Hallett did specifically talk about not learning from other countries in the report, and she mentions the fact that the WHO in 2017-18 was saying you have to prepare for a range of diseases, including coronaviruses. We'd actually learned a lot from SARS-CoV-1 and the MERS viruses in the 2000s about things like testing, contact tracing, isolation, that they do work, right? So actually, it was knowable that there were prevention strategies in place, and we just didn't include them in our strategy at all.
As quickly as July 2020, I wrote quite a long read because people were already starting to maybe massage the statistics a little bit, either to suggest that we are bottom of the league or to suggest that we are top of the league, depending on how you wanted to look at it politically. And what happened was that the pre-existing position wasn't taken at all into account, because I don't care particularly if we did better or worse than Italy or Spain. They were hit first. They knew nothing. We had the advantage of geography. We had the advantage of an integrated public health system. We had massive advantages and time. We had 3 to 4 weeks of a head start. So, considering the givens, we should have been one of the best countries in the world for preventing transmission and death.
And we're an island, don't forget.
Yeah, exactly. Everything works to our advantage.
Quiet Riot.
If I were to ask you to pull out a couple of important subheadings that maybe are likely to get less attention and are a bit more esoteric, but you think are actually quite vital sidelines of inquiry, what would yours be, Christina?
I think one of them actually is around the chapter on risk assessment. She criticises how we assess the risk of a pandemic. And she kind of has these 3 headings that should be part of it, which is what could go wrong, how likely is it, and what is the impact. And I think the kind of general theme is that the UK is very bad at planning for low probability, high impact events. I would go further than that and say that yes, in any individual year, a disastrous event, whether it's a pandemic or a terrible flood or whatever, is quite unlikely, but you do know that it's going to happen and probably happen within the next 10 to 20 years. And so I think on that timescale, it should change our risk assessment to say this is certain to happen. It may not happen in this parliament, but there are things we can do now and should be doing now to make our whole system and population more resilient, particularly because some of the longer term resilience things of having a healthier, less equal population take decades to achieve.
Because it's effectively quite a short horizon. The problem is the government would have to spend money now for something that may happen in 15 years when they're out of power. And that aspect of it, yes, it needs to be looked at. What about you, Tom? What would you choose as a sort of slightly more nerdy point?
Something that I think needs to be absolutely fleshed out in further detail as the inquiry progresses is a judgment on the merits of effectively scrapping Public Health England right at the most crucial time in our pandemic response. I know that it's mentioned in the report, and it was a deciding factor, I think, in how we responded, because it was sort of replaced notionally with the UK Health and Security Agency, which also brought in Dido Harding's test and trace. And I think that a decision to sort of replace said public body at the height of its need is one that needs to be looked at in a very high level of detail.
Yeah.
Well, we had got rid of a lot of our public health infrastructure over the preceding 10 years as well. We were in a much worse position in terms of being able to do good quality contact tracing than we would have been.
Dr. Klaus Kirchele, who is a public health structures expert, says, and is quoted in the report, one of the most worrying insights is how well-known structural weaknesses of UK pandemic response capabilities were by the time of the COVID-19 pandemic. Warnings were not acted on as a result of selective official memory capture. Who wants to help me out with selective official memory capture?
Is that a counterbalance to the groupthink that is being levelled at scientists? Is that to say ministers were hearing what they wanted to hear?
Yes, I think so. And it interests me because it's something that hasn't really been picked out a lot. It's allowed ministers to effectively go out there, do a media tour saying, look, our big fault was not challenging the information and advice we were receiving. We should have been more robust at doing that. But this seems to me to also point to a situation where a lot of people just didn't want to hear bad news.
Lots of us that were in that space at the time would recognise that. And I think one of the problems with the whole groupthink is that perhaps the government was listening to a select group of thinkers. And that ought to be looked at in equal measure as the groupthink.
What about you, Christina?
There wasn't a lot of public health expertise in the room, or a lot of expertise of local communities, how responses have to be different for local communities. But I actually think this idea that ministers didn't challenge enough, maybe, but I also think it's not so much that the experts was at fault, it was that they were given very specific tasks. And what came out in the report when they interviewed them was very clear. We were told, go away, model what happens if this disease spreads with this infection time, this infection rate, this mortality rate. And they weren't told, think about ways you could reduce that death. They just said, what will happen? And they told them. It wasn't part of their remit to offer anything beyond the very specific questions that they were asked. They weren't told what the other groups were doing. They were never allowed to question the assumptions that underlay that. So there wasn't really an opportunity to give different advice. So they kind of asked specific questions that really hobbled the kind of input that these experts could give.
Rubbish in, rubbish out, essentially.
Not the right thing in, not the right thing out, I would say. I would say the answers that they gave are probably quite accurate, but not that useful.
I accept that fully. Do you think Brexit played a role in all this?
Yes, I thought that from the outset, unfortunately. The report confirms it for the first time. Look, it was right from the onset, one of the concerns we had is that, cast your mind back to 2019, the country was in a situation in which a new government had won a big majority off the back of a three-word slogan, which was Get Brexit Done.
Yeah.
The individuals at the top do matter, because it was their life's work. And many people in the field were slightly concerned that basically they would see their first 4 years in power as a single big victory lap off the back of Brexit, and that their entire focus would be on basically ensuring its legacy. And when the pandemic came along, it was very much a very quick realization of the wrong people in the wrong place at the wrong time. We always suspected that a lot to do with the failure of their response to the pandemic was due to them being fundamentally distracted by other policy priorities. So to see it reflected to some extent in the report, saying that the Cabinet Office was giving instructions, redeploy resource to Operation Yellowhammer, which came at the expense of other more important preparatory work, such as pandemic preparedness, is of little surprise, but of huge disappointment.
Yeah, over half the staff of the contingency planning unit was seconded to Operation Yellowhammer. And I think this is also an important point to make. It wasn't planning for Brexit, this big constitutional change that distracted civil servants from pandemic preparedness. It was planning for no-deal Brexit. Specifically, it was the crisis that would flow from that distracted the very specialist staff that deals with crisis. And that was a bluff. It was a sort of negotiating tactic. So it wasn't even that this massive constitutional change that was coming distracted loads of staff. It's that a whole load of specifically contingency planning staff were taken off contingency planning and put on planning for a no deal that everyone knew would never happen.
I mean, I agree with everything you both said. I think there's an extra aspect to the role Brexit played, and that's that by that stage, we'd gotten to this attitude, or we hadn't, but the government had gotten to this attitude of we have nothing to learn from other countries. We can do it on our own. British exceptionalism. We don't need people's help, and we don't need to learn, and we don't need to cooperate.
Yeah.
And I think that really hampered the whole mindset with which we went into what was ultimately a global pandemic. Even the documents within SAGE and the way the UKHSA talk about it and the way Boris Johnson talks about it later, you wouldn't know that anyone else even had a bloody pandemic unless we managed to do better than someone, And so I think that whole mindset was an issue. And I know that I had colleagues working in this space in European countries, and they said when there were European meetings of heads of health departments coming together to try and share learning, you'd often have very senior people from the European countries, and then Britain would send a really junior person to kind of make space who didn't contribute.
There was a mentality that if Europe zigged, then we must zag.
Yeah.
That was automatically the default option.
You've got to remember that at the apex of the government of the time was people like Michael Gove, who famously said we've had enough of experts, and carried that culture through with him. Number 10 chief of staff was Dominic Cummings, who had this obsession with super forecast. As I mentioned earlier, the wrong people in the wrong place at the wrong time. And on the zigging and zagging, as a country, having delivered Brexit, they certainly felt like they had something to prove. And it was often in a direction which was not conducive to responsible government. It was a consistent theme.
Okay, let me wrap up this segment by asking both of you, what was not in it that we haven't talked about yet? What's your pick, Tom?
My pick is memorialization. This inquiry is completely about learning the lessons from the mishandling of this pandemic to ensure that in future, as a country, we fare much better, save lives, and make it through without the disaster that we witnessed on this occasion. Now, central to that, and I don't think this memorialization should be part of this inquiry, but it's important to mention it in these terms, because one of the things that we didn't do, say, after 1918 is a proper way to structurally and institutionally build in the lessons that we have learnt from this pandemic. And what I mean by that is I fully support the recommendation of having a new independent statutory body that is there to test and risk assess our preparedness and hold effectively the government's feet to the fire on our resilience for future pandemics. But at the same time, I think we absolutely need to maintain the importance of this task throughout decades and centuries, because these are the sorts of things that can easily be defunded in future as the political winds change. It's not in the report. I don't think it needs to be, but I do think we need to maintain the idea of national commemoration, both to honour the lives lost and the sacrifices made, but also to ensure that we have a way of maintaining the relevance of these learnt lessons throughout the future.
How about you, Christina?
So again, I think the suggestion of an independent body to plan for emergencies that sits across all the different departments is really important. But there isn't anything in this report to ensure that these recommendations get picked up. There have been various articles that some of the other groups from other inquiries, and actually this one too, so the COVID bereaved families, Grenfell United, the Infected Blood Scandal campaigners, the Hillsborough families have all joined together to call for an independent body that actually ensures that the recommendations from inquiries are carried out and implemented. Because at the moment that doesn't really exist. And so we spend millions of pounds and years of people's lives on these inquiries. And I think generally the quality of public inquiries in the UK is really good. And other countries look at us and say, we're not having that, we don't do that.
Yeah.
And yet there's nothing to ensure that then gets implemented. And so I do think that's missing. And we need to start putting teeth behind these inquiries.
I mean, implementing the recommendations of an inquiry is effectively a political choice. So I understand why that isn't in place. But
should it be a political choice? Or should it actually be, no, you have to do
yes,
it?
I do think it should be a political choice, because otherwise, effectively, anything that gets to inquiry stage has a priority on funding over things that may actually be bigger priorities. It's like you're giving a leg up to, implementing these recommendations as opposed to, I don't know, scrapping the 2-child limit, to give an example. So I do think it should be a political choice, but I do think it should be an active and public choice. So I would probably go halfway to where you are, Christina, and say there should be a body that chases these recommendations through government. And if government wants to not implement them, they should have to say within a certain time limit that these are the recommendations we're taking forward and these are the recommendations we're not taking forward, and this is why. So I think that would provide at least a big element of transparency and urgency to the process.
I do we're obviously allowed to disagree, but I think I would say that there still shouldn't be a choice. I think otherwise governments will be getting out of it in perpetuity. And what are inquiries for, right? They're for things that have gone so wrong that you need to put all this resource into finding out why. And I think when you found out why, then yes, you have to do something about it.
Look, I'm with you like 95% of the way. I just think there are unintended consequences. For instance, the pressure on a judge or a chair running an inquiry when making recommendations, they would probably be much narrower in the recommendations they made. If they knew those then became gospel, it shifts the pressure actually on the chair of the inquiry in a strange way that might inhibit them from giving all of the advice that they want to give and all of the recommendations that they want to give openly. The way it is now, they can say, well, I will make every suggestion that I think is helpful, and then it's up to you, political leadership, to decide what you're taking forward. And I think there are some advantages to that. That's all I'm saying.
Yeah, and even calling an inquiry is a political choice. It's all political choices,
Yeah,
and
of
the
course.
political choice, for example, not to complete exercise sickness and not to see through its recommendations has, through this inquiry, come to bite the previous government. It is up to then the next government and the one after that and the government that is in place in 20, 100 years' time to maintain these recommendations in place. We're talking very, very long time horizons.
Yeah, that's
here,
a good point,
and that's
actually.
why I think the best way to ensure that these, whatever the findings are, actually outlive this government, the next one, and even the next 20, is through having an element of public memory that endures.
So it comes back to your memorializing point, effectively. If I were to pick one thing that was not in it, that should have been in it, I bet you can guess what it would be, Christina, because it's like my massive, massive bête noire, and it wasn't in it. There is not a word on the lack of security and succession protocols in government. I find this utterly unbelievable. Our prime minister ended up in ITU, and the rest of the cabinet, they weren't sure who takes over and via what process. We had situations where the main group of scientists would meet in the cabinet room, and then the whole cabinet, the whole political leadership would meet in the same room half an hour later, occasionally with a birthday party in between. And I simply do not understand the lack of a process which separates, which says, right, you're number one, you're number two, you must never breathe the same air. This is what happens if Team A is incapacitated. This is how we keep Team A and Team B separate. I mean, it is only by luck that we didn't end up with a number 10 that was so incapacitated. It got nearly there, but it could have been so incapacitated that the country was basically left without leadership at the moment where it needed it the most. Now, maybe there are security reasons why this cannot be discussed publicly, but then the report should say that. Or maybe it will be discussed in the next report since it actually happened. I can only hope. But I think it is part of the planning of it. It forms part of planning in most large companies. And I do find it very strange that it's not mentioned. I do think this is an example of groupthink, actually.
Quiet Riot.
Now, I want to focus a little bit on what happens now and what happens next. How does the tone of this report set up Module 2? And when do we think it's expected?
Well, I thought that the frankness of the first report sets the inquiry up very strongly for Module 2. The report was very clear and honest, even in places which were politically complicated. So I think they set themselves up very well for what is a vastly more detailed and complex module in Module 2. In terms of reporting, it is unclear when it is going to report on Module 2. I thought that we could expect both Module 1 and Module 2, not with a huge delay in between the two of them. So it could be any time even this year through to early next year, was my understanding.
So the last Module 1 hearings were a year ago. And so it took a year between the last hearing and to come up with the report.
Yeah.
And the last of the main Module 2 hearings were December. And then they had all of the Home Nation ones early this year. So I would say end of this year, beginning of next year, maybe. But I think it is a bigger module. And I think it's the key, one of the key ones, so it could take longer. I hope the focus remains on structural and governance issues more than just individuals. That said, I was quite encouraged by the fact that she did call out some people by name in this report, notably Hancock and Hunt. And I suspect she will do that. Where there is individual blame to be laid, I think she will.
It's a good point, Christina, because they are meant to be looking at the communication of the measures and rule breaches. So I'm not sure how they get away from names.
I'm slightly more pessimistic on the timing. I think my guess would be maybe summer 2025, simply because under the rules of the inquiry, individuals mentioned in any critical way have to be notified in writing and granted a sort of right of reply before anything is published on them. And there's going to be a lot of people, I imagine, mentioned in the second one. So I think there will be a lot of letters going out to individuals, given a right to reply. Some people might even lawyer up. So my sense is this bit will take slightly longer. Do we know whether Baroness Hallett enjoys support from the bereaved families? I know that they were upset at the remit of the inquiry because they wanted one that sort of apportioned more blame personally, I think, in the first place, and also because they weren't given locus, they weren't given standing in the report, which I know was a great bone of contention. But it felt to me like throughout Module 2, especially with the testimony videos that were shown throughout that module, and with the way that counsel for the inquiry questioned the politicians involved, I felt they seemed to become more optimistic about where this was going and whether it would be a whitewash. So do we know anything about their reaction?
I think it's mixed. It's was going to be complicated from the outset because ultimately the inquiry is looking at the pandemic response from a sort of learning the lessons perspective. Its main objective is to sort of educate policy and structure for future pandemics. Now, I'm very glad to hear that there are at least some members of the bereaved families group that are supportive of at least part of what it has found. But of course, I'd understand if it didn't go far enough, because how far is far enough?
Does having Labour in power matter? Does it change things at all, do you think, Tom? And
Yeah.
this is not necessarily a partisan point. I mean, it is in part a partisan point because Labour has announced its intention to introduce a statutory duty of candour, which I think is quite big signalling that they are in favour of this kind of inquiry and they are in favour of transparency. But the main point is not a partisan one. It is simply that administration has changed between the time the inquiry is looking at and the people who are in charge now. So maybe they will be less defensive about accepting the findings and implementing the recommendations. So, if it had been Labour in power for 15 years, the same point would have been true.
Absolutely. I think the change of government that's happened sort of midway through the inquiry sessions it changes everything. As you say, they're not going to be defensive because they weren't in power. They've already said that they're very minded to take what lots that is being published on board. And, just from a fundamental personal perspective, ministers and secretaries of state that are in power now are not going to be receiving any of those letters from Module 2. So it changes the approach that the government will take quite fundamentally, and in a good way. They'll be more amenable to learn from the failures. So I think it does change the tone in a good way, particularly for those bereaved families who might be looking for some sort of an acknowledgement of failure.
And Christina, the flip side of that, the pessimistic side of that, if you want, is does the emergence of such a strong anti-vax, anti-restriction movement that is completely bound up in all the culture war stuff, will that actually really hamper future public health measures? Will we be starting effectively from a worse position next time round anyway, because we now have a rump of the population that thinks this is all a conspiracy, that there should have never been any lockdowns, that they reject vaccination and all that?
Yes, we are in a worse position now than we were then. I think it started in the US, but obviously has been adopted here. But quite basic public health measures have been weaponized, and I don't know how we get away from that. And particularly with the rise of misinformation and disinformation on social media, which is where a lot of people get their news from. All the stuff around deepfakes and AI, it's very easy to produce really, really convincing misinformation that looks like it's scientific. And I don't know how we deal with that. And we're seeing it already. We've had big outbreaks of measles this year. We've got a big outbreak of whooping cough right now. 8 babies have died this year already from whooping cough, and that compares to 21 in the previous 11 years. Normally, pregnant women are offered the whooping cough vaccine in pregnancy, and it protects their infants when they're born. And uptake's fallen from 75% to under 60% in the last 5 years.
Wow.
And so we're seeing it. We're already seeing it.
Over 15% drop between 2017 and now.
Yeah.
That is astonishing. The other thing I wanted to touch on is that there is a wave of COVID currently ongoing, like a pretty big one. I don't know anyone who hasn't had it recently, to be honest. I've had it. How big is that? How severe is the variant? Why is it in the middle of summer?
The basic questions of how severe is it, how much of it, how many people are affected, we don't know anymore, right? We're not monitoring it. Like we're monitoring hospital admissions, but that's about it, and that's a very small proportion of the number of people who get COVID. It's clear that we're in a pretty significant wave. I would say probably at least as big as the one we had in December when we had the new, what's called the JN1 variant, probably maybe bigger than that even. And it's lasting quite a long time. So a lot of times you see a peak that's lasts like a week or two. This has now been high for 3 or 4 weeks, really high levels of COVID. Hospitals haven't been super strained by it because of previous immunity and the booster campaign targeting the most vulnerable in spring, which is actually quite good timing in terms of the efficacy of the vaccine. But a lot of people are sick. A lot of people have had their holiday plans disrupted, not been able to work. There is still a risk of long COVID, which I know we're going to be talking about later. And it's not a seasonal disease, right? It's 3 to 4 waves a year. I think they should widen the COVID jab eligibility to at least be the same as the flu, and then it makes it much easier. And then you can say, come get both jabs, right? At the moment, they can't say that because a lot of people who could get the flu can't get the COVID jab. I think there was a report I saw recently just of quite how many millions of pounds of vaccines we're about to throw away because they've not been used. And I just think it's insane. And the same with Paxlovid, the antiviral that really protects you from severe disease that you can get once you have symptoms of COVID. Again, it's very, very restricted eligibility here, and we're about to throw away millions of pounds worth of that drug. And it just makes no sense to me. Like, we've bought the stuff, let's use it, right? Let's get it into people.
Which actually provides me with a perfect segue to the final part of this conversation about long COVID, ME, chronic fatigue syndrome, that sort of condition. Naomi, who couldn't be here today, sent me a little note. It really struck me the way she put it. She said the pandemic was not just something that killed loads of people, it was also a mass disabling event. And there is very little attention and airtime on the families struggling with long COVID at the moment. What is our current estimate of cases in the UK, and how do they sort of range in severity?
The UK actually has the best estimates of long COVID prevalence in the world because of the ONS infection survey, which randomly tested people and followed them up over time. And they did a winter survey of infection last winter from October to March, and they released the latest estimates from that in April this year. So we have estimates, they're about 6 months out of date, but that's the best we have. They reckon that about 3% of the UK population have ongoing symptoms from COVID, about 2 million people. And of those, about 1.1 million say affects their day-to-day life a bit. So they notice it. And 380,000 people say it affects their day-to-day activities a lot. So that is a significant, about twice the number of people who have died are suffering really severe symptoms of long COVID. And for many people, it's 3-4 years now of suffering like that. And the burden is highest for middle-aged people, women, and those from more deprived communities.
And it has been weirdly absent from this conversation that the government was very keen to have about all the people who are dropping out of economic activity. And it seems to me quite bizarre, to be honest, that the man who was responsible for schemes like Eat Out to help out should then be getting tough on people who are on any sort of disability benefit, considering they will include a number of people who were infected and are suffering from long COVID, not in small part due to his government's incompetence.
There will be several 100,000 people not working now because of long COVID.
Yeah.
And the government's aware of this. The previous government was aware of it as well. It's been mentioned as one of the contributing factors to a lack of economic activity multiple times since the pandemic, since we got through the lockdown period of the pandemic. And so it's not, it certainly is still there. It was even mentioned in Parliament, I noticed, on the day that the Module 1 report was released, because long COVID is part of the terms of reference of the inquiry itself, and we'll probably see that hopefully be included as part of the inquiry's deliberations throughout. But I think that so long as we've got COVID, there will be long COVID in some measure. And it is one of the more forgotten elements of this pandemic. It's, as Christina says, data is the most important element to it still, and it's great that in the UK we've got more of it than elsewhere, but what we're lacking is sort of a more centralized structural approach to it. But there is still research going into it, and that is desperately needed. And the support is needed, and obviously in particular to the people who were the key workers during the pandemic, who were exposed to the virus without protection. They were asked by the government on our behalf to go and do their job when we were asked not to, and they saved lives, kept systems running, and lots of them have ended up with long COVID. And so I do think that we absolutely need a compensation package for those key workers who are now still unable to work.
In the same way that we would for veterans, I guess.
Absolutely.
Christina, you mentioned Paxlovid, which is this therapeutic that you take once you have COVID, but it can help with the severity of the disease. Does that mean, is there any data to suggest that it also helps stave off long COVID symptoms? Do we know that?
I don't know if there's a definitive study. Maybe there is, and people maybe will be able to share it. But certainly, we do know that the more severe your symptoms are and the more symptoms you have, the more likely you are to develop long COVID. And so by potentially modifying that and speeding up the course of the illness, so basically you get better quicker and with less acute disease, that could help then prevent long COVID. And certainly vaccination also reduces your chance of getting long COVID, but it doesn't reduce it to zero.
And there's some advice on what to do if you do have the infection as well, isn't there? That
because of this kind of association between the severity of symptoms and the number of symptoms and then getting long COVID, there is this idea that actually you should rest as much, even if you have a mild infection, because if you then stress your body further, you're more likely to make it worse. And so I think waiting until you are completely testing negative before you go back to exercise, before you go back to strenuous work and all the rest of it, I think is a very good self-protective mechanism. You should probably do it for any virus, but certainly for COVID. So like seeing Tour de France cyclists carry on cycling with COVID seems completely and utterly insane to me, especially if your career is in sport. And we've seen a lot of athletes actually who have had to stop because of long COVID. And I wonder how many of them went back into training
too quickly. Do either of you know if there's still the possibility of putting pressure in the inquiry to add a module that does look at long COVID? Because I know it was a live conversation at the start, but it sort of disappeared from view.
My understanding is that the terms of reference of the inquiry are pretty much locked, and a lot of time was spent consulting on them. So I'm not sure whether an additional module is possible. I think long COVID warrants its own module, but lots of other people would say that so do many other areas currently covered by the inquiry. My understanding is that long COVID will be covered throughout. It's right at the top, and it's on the front page of the terms of reference of the inquiry. And lots of people spent a lot of time making sure that happened. And I'm also aware that in module 3, it is covered extensively. So I think it is getting some prominence, probably not as much as it deserves, but it's better than not having it at all, which was actually how the original terms of reference were looking.
I did have a look at the inquiry website on modules. It does say future modules can be announced. I don't know if they will be, but it does seem to leave open that option.
Yes, my sense was that if they discovered stuff during the modules that have been planned that basically merited its own module in the future, then they would add it. That was my understanding of it, but I might be wrong, and I invite people that are very, very knowledgeable listeners to write in and either confirm or correct.
I mean, I would say there's a massive amount to be said about it in the inquiry, massive flaws in the fact that we didn't consider it at any point as an adverse outcome to avoid, which just seems insane. The fact that it was entirely predictable that we've had long illnesses from other viruses always, and we specifically had it from SARS-1. So it wasn't unexpected that the long COVID would exist, and yet it never featured into our planning at all. And in terms of it taken seriously, so in the children's module, which is module 8, Long COVID Kids, the charity specifically for children suffering from long COVID, of which I think currently there are about 70,000 in the UK, applied to be core participants, and their application was refused, even though the inquiry's lawyer said that they met the criteria for inclusion. And I think that's really worrying, because it has a massive impact on children, and our policies directly led to mass infection of children.
And it didn't start with their exclusion from being a core participant. Long COVID has sort of suffered a very long and arduous uphill battle for recognition in the first place. That's why I think having a module would be a very good idea, as I mentioned earlier, but precisely because it hasn't enjoyed the focus that other areas of the pandemic have. You know, we're going to get lots on Simon Case and others, and what they thought and who they WhatsApped. But what really matters is actually getting to the bottom of what happened to the people that matter the most in this, which is the bereaved families and those suffering with long COVID.
And there's a big review of long COVID coming out in the Lancet on Wednesday, I understand, Christina.
Yeah, midnight on Wednesday.
And we will try to do a little special extra to cover that.
Quiet Riot.
In the meantime, is there anything we or the listeners can do to raise the prominence of this? You've mentioned a charity. We will drop the link to their website in the show notes, certainly for people to support and donate in whatever way they can.
I mean, I think there are several long COVID charities which are worthy of support, but I think in general, as a country and as a health system, we're really bad at chronic conditions with many symptoms that could be other things. And I don't think we deal with it well. There aren't any real treatments for long COVID yet. People have lost interest in COVID. And to me, that it's maybe understandable, but it's not forgivable when you still have hundreds of thousands of people really, really sick because of it, who are quite desperate for something, anything, any hope that they can have. And I know that my colleagues who are working in trying to find treatments for long COVID are finding that the funding bodies have lost interest and the funding is drying up. Even as there is an incredible wealth of evidence now of biological impacts that are visible on medical tests between people who have long COVID and don't have long COVID. It is a physiological disease. We're beginning to understand much more about it as a kind of an autoimmune disease. And yet everyone's kind of, I don't want to know, right? And so that has to change.
Yeah.
So I think one of the first things is if you meet anyone who says they have long COVID, then please believe them.
Yeah, and I think that takes us right back to the start of the episode and the conversation we had then, which is how strange it is to see this reported so little, to see this feature in the general election campaign so little. I mean, it was barely mentioned. It is probably the biggest trauma this country went through during the last government, and it barely came up. You say that we have a sort of bad record with chronic conditions, Christina. Is that with all chronic conditions, or is it specifically with chronic conditions that we can't easily positively diagnose and for which the symptoms might be slightly more hidden?
Yes,
because
the latter.
it seems to me that there is an attitudinal problem, right? When people think all these conditions are sort of fantasy ones and people are just trying it on because they don't want to go to work. Unless we get over that cultural bump.
And we've seen it with other chronic conditions that weren't taken seriously for decades, things like gut issues, celiac disease, endometriosis for women, where people are like, those that, you're either making up those symptoms or they're not really that severe, or I can't find anything wrong with you. So, unlike, say, diabetes, where there is a blood test that can measure your insulin or blood sugar, or even heart disease and things like that, things where a lot of the symptoms are headaches, fatigue, muscle ache, brain fog, can be lots of different things. And also, it's very easy for people to dismiss you. And I don't think it's a coincidence that people are more dismissed, because it's a lot of predominantly women and people from more deprived areas who suffer from it.
It is. And one of I do think it has to be one of the lasting outcomes of this pandemic should always be that we do understand long COVID properly and we address it and develop medication if possible to help people with it, and that we extend all of that knowledge and understanding to the ME/CFS community as well, because they've been doing a similar job for a much longer period of time. And we do not want long COVID to end up in the too difficult pile.
We love the too difficult pile here at Quiet Riot. And that's it for this special episode. My huge thanks to Christina Pagel.
Thank you for having me again.
And to Tom Brufatto.
Thank you so much for having me.
These conversations take time and work, so please take a couple of minutes to follow, subscribe, rate us, write a review, whatever you can, and actively post something about the podcast Quiet Riot Pod on social media to help us beat the algorithms which tend to ignore anything that is not far-right and rage-inducing hot take. We will be back on Thursday morning with a full episode. Thank you for listening. Bye for now. Quiet Riot is an audio production by Cooler Heads with Naomi Smith, Alex Andreou and Kenny Campbell. Music by Mariana Sangeeta, artwork by Simona Canelu. Quiet Riot is a co-production with Sandstone Global.
Quiet.